Phase 3 clinical studies with Myfortic was done in comparison with mycophenolate mofetil. 2 big studies were conducted in which de novo renal transplant patients, 423 in number, and conversion renal transplant patients, 322 in number, were studied. The primary endpoint was to check for the incidence of treatment failure at 6 and 12 months. Secondary endpoints were cumulative incidence of graft loss, death, and loss to follow-up at 12 months. The study results showed that Myfortic and mycophenolate mofetil were similar. These are the listing of clinical trials of Myfortic for renal transplant which were performed, but the initial 2 which I just mentioned were the most significant. In study B301, the study results showed that both ERL720 or Myfortic and mycophenolate mofetil had similar results when the primary efficacy endpoint were studied. Similarly, for the other outcomes, the results were similar in both the groups. As mentioned earlier and as seen in the slide, the results between Myfortic and mycophenolate mofetil are similar when it comes to any acute rejection and even when biopsy was performed. The secondary efficacy points were similar. Here is the summary of both Myfortic and mycophenolate mofetil, in which we can observe that the study results are similar in both the groups. Hence, the study results were similar. Pharmacoeconomic trials were conducted once the drug was launched, and Myfortic and CellCept, that is mycophenolate mofetil, were compared. As seen in the third box in the slide, which mentions about the savings. Cost minimization analysis of Myfortic, as shown in previous slide, showed that annual savings of about $481 to $1,445 per patient year was observed when patients were switched from CellCept to Myfortic. Myfortic was observed to have lesser gastrointestinal side effects compared to CellCept. Hence, Myfortic provided a better quality of life when compared to CellCept. The trials which were conducted from phase 2 to phase 4 showed that use during pregnancy was associated with congenital malformations. Increased risk of development of lymphoma and other malignancies were observed, basically due to immunosuppression. Immunosuppression also increased susceptibility to bacterial, viral, fungal, and protozoal infections, and hence only physicians experienced in immunosuppressive therapy and management of organ transplant patients should be prescribing Myfortic. All the above which I have just mentioned are mentioned as black box warnings on Myfortic.